for so long. That's just the way it is. It works okay. And to your point, at the surgery center, on average, it takes about 15 days from the date a procedure was performed until the time you can submit that claim for reimbursement through insurance. What other business in any industry would tolerate a 2-week lag from the time that they provided a service to the time they can even start to get paid? Because that's not necessarily receiving payment. That's just filing to be reimbursed. It's really only healthcare. And with what we're doing with this front end speech solution, with the instantaneous nature of the transmission of the data, there's only as much slack in a facility's revenue cycle as the facility allows. The claims submitted for procedures performed the same day, and that's not something that anyone else is able to do currently.
Hello, everyone, and welcome to the Business of Learning podcast. My name is Joao Camargo, and my guest here today is Erik Sunset, who is a CRO at DocBuddy. Erik, thank you so much for being here today. I'm really, really excited for this conversation.
Oh, it's my pleasure. Thank you for the invite. I'm excited to join you today, Joao.
Why don't we start off, Erik, with you just telling everyone a little bit more about DocBuddy. We had a whole entire amazing conversation when we first connected, and we'll dive into so much more of it. But why don't we start off with just the high level, and then we'll take piece by piece from there.
Yeah, absolutely. What a great place to start. So DocBuddy is an organization that's been around since 2014, and we deliver healthcare solutions that take the pain and cost out of broken workflows. For all of your listeners in the health tech space, they'll be very well acquainted with the fact that EHRs, sort of legacy modalities of physicians or surgeons or mid-level providers creating documentation, is really tough. So what we seek to do and what we deliver is actually more time for life for providers and their care teams by getting them away from their computer, sort of their ball and chain, giving them a mobile solution that allows them to create, access, and move data from the point of care.
That's awesome. Thank you for sharing that. And I would love to dive into a couple of the things that we were actually speaking of when we first had our conversation, which sometimes you hear this and the first thing that comes to mind is like, okay, it's a great transcript generation thing. But we all know, or from me, you and I know, that that's actually not the case. So tell me a little bit more about the importance of everything that you guys are going on and the systems and how that integrates, how that facilitates all those things, as opposed to just getting some voice to text.
We said the magic word there, which is integration. That if all you needed to do was store notes on your phone, there's a lot of different apps that can do that. In fact, they come preloaded with apps that can just store data. You can create data just fine, right? So the line that I like to share is that for our customers, we're an app that they use, and we're a portal that their administrative teams or billing office teams can log into. But at our core, we're really an integration business, because if you can't move the data that you've created, and in this sense, in this conversation, the data is clinical documentation. If you can't move that seamlessly, and in our case, nobody has to initiate it moving anywhere based on how the organization is set up, that completed documentation flows where it needs to go. And that's really the difference with these legacy modalities and even sort of wannabes in the market that, sure, you can capture data, but then what do you do with it? Because in a healthcare context, it doesn't matter if that data doesn't go where it needs to go.
Yeah, that's awesome. And I was literally having a similar conversation, excuse me, earlier today as well, which is there's an overwhelm of data everywhere. Everyone can get it. Like, sure, like data free, like it's free for everyone to see it. But then how to use it, that's a completely different story. How do you integrate it? That's a completely different story. How do you optimize it so that the results come through? Completely different story. So it's really cool when you're sharing with me how all those steps are happening in the back end to allow the facilitation of these processes. And tell me on the opposite side, the current things that a lot of these providers are going through, which is that pen to paper or maybe typing it on their computer, having to send it over to their assistant, to their secretary. Okay, put this in for me, and how you guys are able to just absolutely smack that out of the park and not having them deal with all those things anymore.
Absolutely. So I may have sold us a little short by describing us as an app that our customers use. It's really a platform. We occupy a really interesting niche in the market, that we have solutions that are in use at the clinic. And these are EHR integrated functionalities, as well as ambient voice. So like AI note takers and AI scribe, that's a part of it as well. And where we're breaking the chain there is that we're saving providers on average 90 minutes per day in their documentation, which would otherwise take place in that legacy electronic health record, and you hear about all of the burnout that physicians in the US and Canada and the UK and really everywhere around the world, they are so burdened with documentation that it's driving them out of the profession that they joined because they want to help people. Instead, they become their own scribe. They're spending 2/3 of their time away from patients. So if we're able to give back 90 minutes per day to the provider on the clinic side of our business, that's huge, because that's time that providers can spend with their families and doing things that matter to them. So we're sort of breaking the mold on the clinic side and giving that much time back. Then potentially more interestingly is that on the surgery center side, that was withheld and sort of exempt in a way from the CMS mandate to move to an electronic health record. And this is going back in time now, I guess 16, 17 years. On the legacy side of documentation generation for the surgery center, that's happening with a 100-year-old workflow. That's transcription, where you record a voice file, it goes somewhere else, it comes back typed up at some point in the future. That then needs to be signed, finalized, and then routed manually wherever it needs to go, which is obviously to the records at the surgery center, back to the provider's clinic. If you have an external revenue cycle team that does your billing, it needs to be sent there too. That's another mold that we're just absolutely breaking, that with our front-end speech solution, which is called OpNote, you're removing all of that delay from both the facility's revenue cycle as well as the clinic's revenue cycle with an instant operative report that nobody has to move anywhere. It just goes where it needs to go. So that's highly promotional. Thank you for humoring me there. But
no, it's awesome. And I mean, if there's value being driven, then share the value. Like, please do, right? I think it's one of those things that's interesting about being able to, like, conversations like this, that there's so much out there that people sometimes might not be aware of, and like, hey, this thing can literally solve every single one of your problems. Learn about it. Like, it's really, really cool to learn about those things as well. And I think this might be me confusing it with another conversation that I had, but I believe when you were speaking about that speed, there was a certain number attached to it, where like an average process would take about like a week or 2 weeks, 15 days or something along the lines, and that changes to instantly. Is that disturbing me?
Your memory is spot on. And if I can expound a little bit, just sort of in general, it's amazing the healthcare workflows that the industry has tolerated for so long. That's just the way it is. It works okay. And to your point, at the surgery center, on average, it takes about 15 days from the day the procedure was performed until the time you can submit that claim for reimbursement through insurance. What other business in any industry would tolerate a 2-week lag from the time that they provided a service to the time they can even start to get paid? Because that's not necessarily receiving payment, that's just filing to be reimbursed. It's really only healthcare. And with what we're doing with this front end speech solution, with the instantaneous nature of the transmission of the data, there's only as much slack in a facility's revenue cycle as the facility allows. The claims submitted for procedures performed the same day. And that's not something that anyone else is able to do currently.
Wow. I think it's one, super exciting, because that solves so many problems. But two, it's also really cool for the providers and for the people that are in the day-to-day that can learn from this thing, and just being aware that it exists. It can allow the process for themselves, but then for all the team around them and everybody that's going through that as well, it just like, it becomes so much faster in that sense. And then I guess shifting the conversation a little bit more onto DocBuddy as a business itself, tell me about that awareness side of things, because it sounds to me that so many of the health professionals can sometimes not be aware that tools like this exist, platforms like this exist, that can expedite a lot of these the day-to-day things that they go through. So what are some of the challenges when it comes to showing that you guys exist, having that awareness, creating a lot more of these opportunities to, of course, create the impact that you want to achieve, but also grow the business as a result of it as well?
I want to start by answering your question with a question back to you.
Okay.
And obviously, we know healthcare will be included in this, but what other industries use fax as a mechanism for communication regularly?
Oh, man. Funnily enough, I literally had a podcast guest recently who said that fax is their best method of marketing, but that's a completely different story. And it actually, for their business. It made so much sense. But I can't think of any other businesses that use it, to be quite honest. No.
I'll throw you a bone, like the federal government, the
Oh,
IRS comes to mind. So
yeah, yeah,
if you're in the same bucket as the federal government for cutting edge tech being like a fax or smoke signals or carrier pigeons, you're
yeah.
just living so far in the past. And we already kind of hinted at this, that our number one competitor, Joao, is the status quo. Oh, we've always kind of done it this way, and
Yeah.
it works okay. We can pay the bills, we can pay the partners distributions, and everybody's kind of happy.
Mm-hmm.
So as we go to market, and as I mentioned, our core products, our clinic products, and our hospitalist on-call products have been around since 2014. Our surgery center products are a little bit newer, but still have been mainstays going back to 2021 or so.
Mm-hmm.
It really does come down to education. And you have to know who you're talking to. You have to know who you're engaging to first provide that education and then get the chance to show them the solution. I'll try to pull all this together here, but I come from a long background in legacy health IT.
Mm-hmm.
Demo can take an hour, could take 90 minutes, where you're demoing the business aspect of a PM and EHR, and then you have to show the clinical aspect to the providers, and you lose people.
Mm-hmm.
And that's something that everybody's well acquainted with now. They're like, oh, great, another EHR demo I got to sit through, or oh, great, I already know what the software does. If we're able to provide that education that, hey, there is a new way. The analogy we like to use is, think about driving to Blockbuster Video, picking out your videos that you want around. Hopefully they have it on the shelf. Maybe you get some Sour Patch Kids and a box of popcorn to pop while you're watching the movie. And then Netflix comes along.
Yeah.
And first they're mailing you DVDs. And I remember thinking that was really cool. I don't have to go anywhere. They just come in the mail. And now obviously with on-demand streaming, if you had walked up to a family in Blockbuster in 1999 and gone, you're not going to believe what's coming. You're not going to have to go anywhere to watch whatever you want to watch, essentially. We're having to do the same thing, because it begins first with incredulity. Like, yeah, that sounds really good, but I'm not sure that I believe you.
Yeah.
And then to come back to this demo aspect, our solutions are really slick, and they demo in about 90 seconds on the short end. So just sort of like flyby, here's everything it does. What do you think? And I had this experience last week in Orlando at a surgery center event where a handful of folks walking by our table are going, instant? Yeah, right. There's nothing instant about anything we do. And then you can show and tell, and it's the jaws drop. Like, wow, I didn't know that was possible. So it really is an education in what's possible, and breaking that status quo.
Yeah. So I think that's powerful too. Like, just educating them on the process. It's not like it's not like, hey, I'm just telling you. It's like, I'm educating you through how important this is and all the problems that it solves as well. And it's interesting because I think part of that is also the lack of awareness on the opportunity cost and the cost of it doing things the way that we've always done it before. And it's like, oh, it's just how we've known it. Because they think that, hey, if I just do this for myself, I'm not paying anyone to do it, therefore I'm saving money. But investing into something that can bite the back that time makes you more money. And then for some people, educating them through that process can be difficult.
Yeah, and this is you can pull me off my soapbox anytime you want, but in the run up to COVID, staffing for healthcare organizations, at least in the US, was tough. If you weren't the hospital, because the hospital will, as a rule, they'll pay more than your clinic, they'll pay more than the surgery center, but you're also in that hospital environment, which not everybody's built for. And I'm speaking secondhand here. I'm just a lowly vendor in the health IT space. I don't have any frontline healthcare experience. But then you get out of COVID, and the classic healthcare fix of like, we have a bad workflow, but if we just hire like one or two more people, one or two more FTEs, we'll just throw manpower at it and fix it. Coming out the other end of COVID now, staffing is still really difficult. And part of it has to do with the wage disparity between working at the hospital and working at the surgery center or working at a clinic. But you can no longer just wave that magic wand of like, well, just pay a couple more people to fix this. It's not possible anymore. So to your point, there's an opportunity cost for manual workflows that take up FTE time, because there is a cost there. It's not a cost that you see as a line on a P&L.
Yeah.
It certainly costs your organization time to do these things with people, when there's no reason for people to do these sort of menial tasks. And I want to be very clear. I'm not saying that you do not need people in your healthcare facility, because you do. But
Yeah,
instead of sending that fax with a completed operative report or sending that secure email back to some other place that needs to go, they should be engaged in patient care. My revenue cycle background will come through here, that if patient care is already handled, and you've got a great clinical team and a great sort of customer service team, what about patient accounts? What about actually generating revenue for the business instead of being a pure cost? Fax this, email that, turn that voicemail. We're living in crazy world here.
Yeah. I like how you tie that back to making the business thrive. So not only survive, but thrive, because at the end of the day, business is business. Yes, there's the impact that needs to be achieved. Yes, there's the goals, there's all these things. But if I love this quote, which is without vision, people perish, but without money, the vision perishes. So it drives that point of like, how can we tie this back to how can we keep improving the company so that we can have the better vision and that we can have that mission accomplished that we want to get as well. And I'm interested to hear from like a growth sense as well, tying it back to what you said before. Is there like a hesitancy that comes with a lot of these conversations when these conversations come, or is it even like starting those conversations in the first place? Like, people, they think it's too good to be true, so they don't even want to give you the time of day. Like, tell me a little bit more about that.
In our particular case, I think about some of our trade show materials, and the surgery center is a really interesting arena. It's a very much in-person space. The great folks that work at surgery centers, they want to know who they're talking to. Like, the brand matters, but is this a normal guy or is he just blowing smoke?
Yeah.
So when I think about what our booth display looks like, it's got in 3-foot high letters, instant operative reports. And it's kind of interesting because that's what everyone at a surgery center, whether they're in administration or in the business office or on the billing team, they all go, "Oh, wow, that would really be cool." And they walk up and are saying like, "Show it to me, I guess. Like, I'd love if this was possible."
Yeah.
And luckily in our case, it is, and we're able to demo that very quickly and very rapidly. So the education starts there generally at the business office. There's obviously a surgeon stakeholder to this as well. And they're used to this dictation workflow. They're used to talking out their notes. There's a couple specialties that are withheld there. So your ophthalmologists, your gastroenterologists, that is to be fully correct there. They've got a very templatized type note, and we can absolutely help them if they prefer to dictate to have their completed operative reports. But they're pretty well served out of their desktop software, just because there's not a lot of change in what they do. There's a couple variables, and you can get complete documentation sort of with minimal effort. So the surgeon stakeholder is really important, but we're not asking them to change their workflow. Instead, we give them a tool that digitizes their output. It digitizes their work product for the rest of the downstream stakeholders. So once you can get kind of sort of past that, like, "Oh, I've never known that anybody could do this before." We see it. Yes. "Oh, I'm not sure my surgeon's going to like this change." It's really simple from there, because we're not really asking them to change. We're asking them to use our app. They still do what they're used to doing, but instead of bogging them down with knowing they're going to need to sign a prescribed op report when it comes back, they can sign it from the point of care and move on to the next patient.
Yeah. Just becomes seamless, becomes frictionless. It doesn't, it's not like adding things to their plate. It's just taking things away from the plate. Really, really awesome. I want to ask a question as well, Erik, which is one that I've been asking almost every single guest that I've had on. I think it's a great question that takes off the cap for thinking. So we'll start with that, and then I'll go on to my final question for you here. So here's the first one, or maybe I don't even know how many questions we're in now, but let's say you had a magic wand and you could just wave this phenomenal, amazing wand to solve one thing, one obstacle, one challenge, one hurdle within the company that would allow you to hit all your revenue targets, your growth targets, your client acquisition targets, specifically looking at those things. And when sometimes as business leaders, we have so many priorities, so many things that we want to focus on, so many fires to put out. You solve with this one thing that is in your control. So nothing like government wise, in your control. What's the one thing you like to solve to achieve all those targets?
That's a good question. I think to start, so I'll go internal and external here.
Okay.
Externally, for the market, this comes back to sort of a central theme of our talk. that just because you've always done something a certain way doesn't make it right, and it doesn't make it good even.
Yep.
So I think all of healthcare is sort of crossing the chasm now from like the very forward-looking physician practices and ASCs and hospitals. They're looking past sort of the bare bones requirement to be electronic. And this is going back to the Meaningful Use Bill and the High Tech Act. Everybody knows that that's not good enough in the space, but it's really only the forward-looking healthcare organizations that are going, there's got to be a better way. Like, we know this is hurting the profession. We're losing physicians to retirement. We're losing physicians to getting their real estate license. You hear about that every week. Guys close their shop and gals close their shop. It's just not worth it. So I'm really pleased that healthcare at large is taking that first step to cross their own chasm, that tech shouldn't be a burden. And there are some governmental inputs there that make it slightly more burdensome than like a pure commerce play would be, just strictly business without government oversight. And then internally, we've got such a fantastic team. We're in high growth mode. We've added a ton of headcount over the last 12 months. And just to be greedy, so Gordon Gekko, right, from Wall Street, greed is good. You know, I'd love to see our team grow overnight, double, triple in headcount and capacity, because this is so much more than selling something to DocBuddy. We're evangelizing a mission to give providers more time for life. That's always been our core focus. And I think the faster that we can do that, we can do more of our parts to keep physicians practicing, get them away from the tech that's driving them out of the field. I want to add one footnote to that. The reason I'm so dialed in on tech is that both pre-COVID and post-COVID, and that's a big inflection point for burnout factors for physicians, at least in the US. And I think this will probably be true further abroad as well, that legacy technology and a lack of autonomy are the two top things that are killing the profession of being a physician. That's a big problem. And you hear a little bit about this in the news about a lack of anesthesiologists, where certain states in the US are lifting their requirement for certified registered nurse anesthetists, so CRNAs, like a mid-level anesthesia provider. They're lifting their requirement to have an MD anesthesiologist oversee them, because there is not enough anesthesia to cover all of the cases that are scheduled. So that's a big problem. You can kind of hear that in mainstream news, on cable news. This cataclysm that we're slow motioning towards, we're going to have these same types of headlines around physicians in general, you know, by the early 2030s. That's a big problem, especially with the population age in the US. Our baby boomers getting older and needing more care. So really, everybody needs to be pitching in, both from a government perspective, from medical school perspective. Vendors need to be delivering meaningful solutions, because without physicians to take care of you, where are you going to get care? Who's going to help you?
Yeah. No, that's awesome. Thank you for sharing that. I appreciate that you went very detailed with that answer, because it's really cool to understand like everything that's happening internally and externally too, and how they tie together. But not only that for the growth of the business, but also for just tying back to what we said before, the mission on helping these people live better lives, which is the goal, it seems, to you guys as well. And then final question that I have here for you, Erik. It's actually not a question from me. It's a question from our last guest to you, and they had no idea who you were. So here's the question. You ready for it?
Hit me.
This is an interesting one, because I think you actually alluded to this earlier. What is the hard ROI your company brings to your clients?
Oh, wow. That's actually a really good one. So there's a head-to-head cost comparison. And one of the things of beauty about what we do, we've got several different pricing models that can accommodate a replacement of the legacy process, almost penny for penny, very, very close in terms of pure invoiced cost comparison. Where it gets interesting, though, is around the FTE value of time. So how much time is being spent on tasks that we can basically have a magic wand for? You don't have to do those anymore. So there's an FTE time component. And then I think the most meaningful time value of money component is that, and this is like a crazy stat, and I promise it didn't come out of our marketing department, but based on the average time to submitting a claim versus our average time to submit a claim for DocBuddy users, it's 2,700% faster, which is
There you go.
Crazy. It sounds crazy, but that's the actual calculation. So again, just to reiterate one final time, the physician, the surgeon workflow doesn't really change. You get a digital outcome as the output. So you get paid faster and staff spend less time wasted on menial administrative tasks. So it's what we like to think it's a pretty strong value statement.
I mean, 27x, I'll take that any day of the week, right?
Same here.
For sure. Yeah, Erik, thank you so much. This has been such an incredible conversation. Where should people go if they want to learn a little bit more about you? Shout out the podcast that you run as well, please. That would be awesome. So anything about yourself, and of course, also anything about DocBuddy.
Absolutely. Thanks for the platform, Joao. For people interested in learning more about DocBuddy, docbuddy.com would be a great place to start. That's DocBuddy.com. I know they have a link in the show notes for everybody. We've also got a really great long-running health IT podcast, the DocBuddy Journal. That covers all aspects of healthcare, from policy to tech to workflow. We talk a ton about AI in healthcare. So I'd appreciate any listens folks can throw at me there. And then on LinkedIn, you can find me at Erik Sunset. Would love to connect with you. Would be happy to spitball with anybody that reaches out.
Amazing. I will, of course, as Erik said, leave everything down here in the description if you want to check that out. And if you are still hearing this episode, you enjoyed this conversation, you want to hear more conversations like this, please hit the subscribe button, and I will see you on the next episode. Erik, thanks again so much.
Thank you.